Vicodin and OxyContin are the brand names of hydrocodone and oxycodone, powerful painkillers that are contributing to widespread drug addiction, especially in the U.S. These drugs and others contain opioids or narcotics, and while doctors often prescribe these drugs to help control chronic pain, they can lead to addiction. In the United States, sales of prescription opioids have quadrupled over the past 20 years.
The opioid epidemic has grown exponentially. It really began in the mid-1990s when physicians were encouraged to do a better job of treating chronic pain. In 2014, there were approximately 19,000 deaths that were attributed to opioid medications.
Don't have to be rich.
Prince's death last June was from an accidental overdose of an opioid drug. The Centers for Disease Control says in the U.S., 48 people die every day from opioid overdoses. A new study shows that in a 16-year period, more than 13,000 children and teenagers were hospitalized for opioid poisoning.
We found that the rates of hospitalizations for opioid poisonings doubled during 1997 to 2012. We also found that the highest number of hospitalizations were among teenagers, ages 15 through 19. The highest rates of increase in hospitalizations were among our youngest population, which was 1 to 4-year-old children.
The researchers say the way these drugs are prescribed, disposed of, and packaged needs to change. Accidental ingestion by infants is especially troubling.
Our national conversation has focused on how to improve the treatment and prevention of opioid misuse and abuse. But we also hope that this conversation focuses on how to safeguard children from this epidemic.
The study was published in JAMA Pediatrics. Carol Pearson, VOA News, Washington.